Vasquez, a student nurse from KLD, and today I will be in charge with doing the general preliminary procedures, general survey, and the assessment of the skin. Sir, I am student nurse Cedric Vasquez from KLD po. Kayo po ba si Adrian Vergara? Yes. So, bali po ang gagawin po natin ngayon ay i-sedate po natin yung vital signs nyo. Tapos i-inspect ko po yung skin nyo para po meron tayong baseline information para magamit po natin in the future kung sakali pong magka-problema kayo at ma-admit po kayo ulit dito. Simula sir, ayusin ko lang po yung lighting natin, tapos i-close ko po yung blinds para may privacy po kayo. So, comfortable po ba tayo nun, sir? So, if you have any other questions po, don't hesitate to ask po, and if you feel any discomfort, just say it lang po.
As the client was entering the premises, I inspected his overall physical appearance. I noticed he was an adult, aged 18 to 25 years old, had a dark brown skin tone, and he was responsive when I first interacted with him. I also inspected his body structure and noticed that his stature was good. His posture was straight and not slouchy. He was skinny and he had no obvious physical deformities. Then I inspected his mobility. His gait was normal, no obvious struggles when he was walking. I then inspected for any signs of distress in behavior. His facial expression and mood was calm and collected. He had good hygiene and grooming based on his appearance, and his speech was understandable and not slurred.
Okay, normal naman po yung temp nyo, 36.7 po. Sir, i-check po natin yung pulse nyo. So, so balik mo yung pulse statements. Yung sa respiratory is 16 beats per minute. So, wala naman po lang normal is 3 pound per pulse rate per pulse. Respiratory rate po is normal. Yung second po natin is yung A-rated allergy to bars.
Due to technical difficulties, some of the videos were corrupted and remained unusable. In the physical examination of the skin, the first thing I did was ask the client if he had noticed any skin changes recently. I then inspected the uniformity of the skin color by checking for any inconsistent changes in the skin I then inspected the vascularity of the skin by looking at it thoroughly and noted for any lesions, bruises, or tattoos. Next thing I did was determine the temperature and moisture of the skin by rubbing the back of my hand across his arm. I then palpated and pinched the skin to assess the mobility by noticing how fast the skin elevates, and third, by noticing how long it takes for the skin to snap back to normal. I then checked his leg to determine the presence of edema by poking his lower leg and noticing how fast the area came back to normal. After the physical examination of the skin, I documented the findings and evaluated that his skin is healthy.
Good afternoon, ma'am. I am student nurse Ruth from Colegio ng Lungsod ng Dasmariñas, and I will be assisting you today for your physical examination. May I know what is your name, ma'am?
I'm Marcel.
And how old are you, ma'am?
54.
Okay, so today we will proceed for your physical examination. This will take about 5 to 10 minutes, and I will check your hair and scalp specifically. And I will just draw the curtains for privacy. Are you comfortable right now in your position?
Yes.
Okay. So if you feel any discomfort throughout the procedure or if you have any questions, we're free to ask. Okay. So I will now start. I'll just prepare the equipment. Okay. So I will just ask a few questions, ma'am, and you just need to answer it honestly. So, for the past months, have you experienced any sexual developments? Okay. You have mentioned a while ago that you are already 54 years old, right? So, do you still have any menstruation? Do you still experience menstruation? Okay. May I ask, what is your primary health concern today? Why did you come to the hospital? Okay. Can I check your skin color, ma'am? Thank you. And can you sit straight, ma'am? I'll just check your posture. So for the past weeks, have you experienced, or right now, do you experience any stress physically and emotionally? You're not experiencing any distress or pain that may cause you any mood swings? Okay. So now we will proceed to your vital signs. We'll first check your temperature now. So all your vital signs, ma'am, are normal naman po, which is good. And you have taken your weight and height a while ago. So your weight is at 64 kilograms and your height is at 5.2 inches. So when we compute it, your BMI is 25.8, which indicates overweight. So you have to manage your um, nutrition, ma'am, your diet. You have to have adequate nutrition, and you also have to maintain regular exercise. So now I will inspect your hair and scalp. I will just palpate your hair. So I have noticed, ma'am, that your hair is a bit thin. And is it really thin, ma'am? Okay, so it has been thin for a while now. Have you experienced any hair loss for the past months? Okay. And the distribution of your hair is also low. As I have no, as I have said, it is thin, and as I have palpated, you do not have any lesions or masses, which is good po. Your hair color is brown. I have noticed. Is it natural, ma'am, or did you color it yourself? So you colored it. So thank you for your cooperation, ma'am. I am now done inspecting or examining your hair and scalp, and my corners. I will endorse you to my corners, and she or he will be the one to inspect your other body parts. Thank you for your cooperation, ma'am.
So hello guys, I will check the nails of the patient. Inspect the nail of patient shape and contour. So yun, chinecheck po natin. So, number 2 is inspect the nail surface consistency. So wala naman abnormalities. Then yung color, hindi naman po ganun which is normal naman po yung color niya. So ayun, chinecheck lang. Sa last naman po ay perform po natin yung blood test to determine the capillary refill time. So, which is normal naman po, bumabalik naman po sa 2 to 3 seconds. Thank you.
Good morning, ma'am. I'm Adrian Vergara. I'm a student nurse from KLB. So today I'm going to assist you. Okay, ma'am, what's your name again?
I'm Shirley Ann Peterson,
Your age
18,
and your birthday.
October 6, 2005.
So today, ma'am, I'm going to assess your physical examination, specifically your skull and face. So all the data and information that I will be collected is very important to your overall health status. So if you have any questions or concerns, don't hesitate to ask me or inform me. Okay, ma'am, are you comfortable with your position?
Yes,
So the next procedure, ma'am, will be taking your vital signs. It's okay with you? So your pulse rate is 76 beats per minute and your respiratory rate is 18 breaths per minute. So I'm going to take your blood pressure. So mom, your blood pressure is 100/7. So now, ma'am, I'm going to get your weight and height. So proceed lang tayo sa side, ma'am. Okay, ma'am, your weight is 44. So I'm going to take your height, ma'am. Okay, ma'am, your height is 154 centimeters. Thank you. Okay, ma'am, for the next procedure, I'm going to inspect your skull and your face for the size, shape, and symmetry. Okay, ma'am. Upon assessing your skull and face, there is no presence of nodules, masses, or depressions. So all the facial movements and your facial features is normal. Okay, ma'am, thank you for your cooperation. So if you have any questions or clarifications, don't hesitate to inform me or other nurses assigned. So thank you po.
Thank you.
Good day everyone, I'm Charlene Ann Toledo from BSN 108. So today, I will be demonstrating the general preliminary procedure, general survey, and for the physical assessment is the eye structure and visual acuity. Good day sir, I'm Charlene Ann Toledo, your student nurse for today. So may I know your name sir? Okay, your age, sir. Last year birthday. So today, sir, we will be having two assessments. First is the general survey, and second is the physical examination, specifically in the eye structure and visual acuity. So for the general survey, it is a quick checkup of your overall health. It helps us to understand how you're doing at first glance. So for the physical assessment, this will help us to understand how you're doing physically, and this also help us to identify any areas that we need attention. So sir, comfortable po ba kayo sa position niyo ngayon? Your questions and cooperation we will be needed in these two assessments. So your questions are crucial to your understanding and care. So feel free to ask questions or anything about your health, treatment, or any curiosity you may have. So I'm here to offer clarity and support every step of the way. So shall we begin, sir? Upon inspecting the client's overall physical appearance, the clients appear well-nourished and healthy. There are no presence of any abnormalities. Upon inspecting the client's body structure, the client's posture is erect and symmetrical. There are no any obvious physical deformities. For the client's mobility, it also appears normal. Upon inspection, there are no signs of distress or discomfort. The client's facial expressions is also normal, as well as his mood and speech. The clients also have a good hygiene and grooming. So sir, now I'll be taking your vital signs. Is it okay? So ngayon naman sir, we will be checking your height and weight para po makompute po natin yung body mass index nito or your BMI. So punta lang po kayo dito sa weight po natin. So your weight mo is 67 kilogram and for the height is So sir, upon inspection, your eyebrow, eyelashes, and eyelids seems symmetrical po and normal. So same with your anterior eyeball and sclera. So your eyeball is circular, your sclera is white, which is normal po. So yung color and texture po ng bulbar and palpebral conjunctiva nyo is normal, wala rin pong presence na lesion. So, normal naman po. So, sir, for your lacrimal gland, lacrimal sac, and nasolacrimal duct, there is no presence of lesion or swelling po sa mga nabanggit. So, normal naman. So, sa iris and pupil naman po, it's color brown, then circular, and symmetrical naman po sila to each other. So ngayon naman po sir, i-check and inspect natin yung reaction ng pupil niyo po sa light. So gagamit po tayo ng pen light and bigyan po natin yung light to check the light reaction to accommodation. So sir, upon checking your pupils, normal naman po yung reaction niya sa light and reaction sa accommodation. So nag-constrict po ito which indicates normal. So sir, ngayon naman po, gagawin naman po natin yung confrontation test which is, ini-expect naman po dito yung peripheral visual fields niyo po. So, ang gagawin po natin, yung isang side po ng mata nyo, i-close po natin. So, close sir, then titingin lang po kayo sa akin directly, then ipo-point ko po yung fingertips ko here. Then, kapag nakita niyo po, sasabihin niyo po, stop. Okay? So, okay sir, 1, okay po. Okay yung last six. Okay po, last. Okay po. So, okay po sir, okay naman po tayo sa confrontation test. So, next po is, we'll be inspecting your 6 ocular movements. Then, tawag naman po dito is extraocular mass diffusion. So, dito naman po, igagalaw ko lang po yung hands ko, then susundutan nyo lang po with your eyes. Hindi po kailangan gumalaw yung head nyo. Dapat po, sinusunod lang po siya ng mga. Okay po. Start po tayo, sir. So, pati 1, 2, 3. So, and okay naman po tayo sa inspecting your 6 ocular movements. Okay naman po. So, last po for eye structure and visual acuity is the near vision and distance vision po. We will be inspecting naman po your distance vision. So, meron po tayo dito Snellen chart. Then, tatayo po kayo and i-check po natin yung left and right eye niyo po. Then, ito po, i-cover niyo po siya using the opaque card. So, ito yung siya. Okay po. Okay naman, sir. Ang pagbasa po ng number 4.
L, F, E,
Okay, number 3.
E, Q, C,
Number 2.
F, E,
And 1. So, sir, okay na po tayo sa distance vision. Next po natin is yung near vision. So, I have here the trigger chart. So, babasahin niyo po yung number ng pinakakaya niyo pong basahin. Una po is the left side of your eye muna. So, it should be 14 inches apart. So, pa-cover po yung isang eyes. Yeah. Okay, basa po yung pinakakaya niyo pong basahin ng number.
number 4.
Okay po.
Exert for Augustus the relinquished ambitious design of subduing the vulgar and to introduce a spirit of moderation into the public councils. Inclined to peace for his temper and situation, it was very easy for him to discover that Rome in her present
Okay. So, yung isang, yung right eye mo po. Ganun din sir kung ano po yung kaya mo sa
number 5. The undertaking became every day more difficult, the event more doubtful, and the possession more precarious and less beneficial. The experience of Augustus added weight to the solitary reflections and effectually convinced him that
yung both eye mo po.
the nations of the earth, the principal conquest of the Romans, were achieved under the Republic, and the emperors, for the most part, were satisfied with preserving those dominions which had been acquired by the policy of the Senate. The active emulations of the consuls and the martial enthusiasm of the people, the 7th centuries with
Okay po, thank you sir. So, sir, we're done po in general survey and physical examination, especially with your eye structure and visual acuity. So, i-update lang po namin kayo whenever or when it's needed. So, again, We are here to offer clarity and support you every step of the way. Thank you, sir, for your cooperation.
Ma'am, I'm student nurse Ray from BSN 108. So, ang gagawin po natin, ma'am, i-assess po natin yung ears and hearing nyo. Okay lang po ba na kunin ko po yung information nyo? Ano pong pangalan nyo, ma'am?
Miss Pia Perito po.
So, Miss Pia. So, ilang taon na po kayo?
19 years old.
Your birthday, ma'am?
November 23, 2004.
Sige po. Are you comfortable with your position naman po? Hindi naman po kayo nahihirapan?
Hindi okay.
Sige, okay po. So, ma'am, before we start, kunin ko lang po yung vital signs nyo to check if normal naman po lang. So, 35 points. So, kuhanan ko lang po kayo ng BP, ma'am. So, check lang natin. So, large. So, ito yun. Ko alam kung tama yung mga palpit. Bawal na sila ito. Sana yung mga palpit. So, ma'am, titest ko lang po yung, yung hearing niyo. So, naririnig niyo naman po ako. So, your name po is Pia. So, pwede pong ulitin niyo kung ano yung sinabi ko.
My name is Pia Perito po. Okay naman po. Okay naman yung hearing ko.
Naririnig niyo naman po. So, next po is... So, nararamdaman niyo naman po.
Opo.
So, dito lang sa kabila. Pause mo. Kabila niyo. Pause mo. So far naman po, ma'am, wala naman po ako nakitang abnormalities sa ears and hearing niyo. So, okay naman po siya. So, wala naman po tayong dapat ikabahala. So, okay po. Yun na. Thank you po.
Good afternoon, sir. I'm student nurse Godelisa L. Olete, and today I'm going to assess you physically, specifically your nose and sinuses, sir, to check for any irregularities. Do you consent me to proceed po?
Yes.
Okay, before proceeding, sir, I have to verify your identity first. Can you state your name?
Yes.
What's your name, sir?
Alex N. Olete.
Your age
I'm 16 years old.
and your birth date.
January 10, 2008.
Okay. How do you want me to address you, sir? Is it Mr. Sir Olete or Sir Alex?
Sir Alex.
Okay. Okay, Sir Alex, before anything else, I have to obtain your baseline data or your vital signs, including your body temperature, your pulse rate, your respiratory rate, and your blood pressure. Are you comfortable in your position, sir?
Yes.
Okay. All the information that you will be sharing here will all be treated confidentially. The patient is being assessed in a closed area to ensure the client's privacy. If you feel any discomfort or inconvenience, sir, please feel free to tell me. Okay? I will now perform hand hygiene. Sir, I am now going to take your body temperature using the thermometer. Sir, can you please malamig? Sir, hold it until it beeps, saying that the reading is done.
Yes. Thank you.
Okay, it's done, sir.
Thank you.
Your temperature, sir, is 35.9.
Normal.
It's normal, sir. Next, I'm going to take your pulse rate, sir, for 1 minute. Next, I'm going to take your blood pressure, sir. Sit still and relax. Okay. Your vital signs, sir, are normal. You don't have anything to worry about. Moving on, Sir Alex, I will now assess your nose and sinuses. Sir, do you have a history of allergies,
No.
sinus infection,
No.
injury in the nose or face?
No.
Oh. Sir, do you experience difficulty breathing through the nose?
No.
How about nosebleed?
No.
Changes in the smell?
No.
Okay. Sir, I will now inspect your nose externally to check for your nose placement, alignment, and symmetry. Please hold your head back, sir. Okay. Your nose is symmetrical and straight, sir. It has a normal placement, alignment, and the color is uniform. Sir, I will now lightly palpate your external nose, sir, to check for any tenderness, masses, or any displacement in your sinuses, sir. Please feel free. Please sit still and relax. Okay. Okay, sir. I am done palpating your external nose, sir. It shows no tenderness or masses or any displacement in your sinuses, sir. Next, I'm going to determine the patency of your nasal cavity, sir. Pwede niyo po bang, Sir Alex, pwede niyo po bang harangan yung isa yung bilong tapos huminga po kayo sa kabila? Nakakahinga po kayo?
Yes.
Sa kabila naman po. Okay, sir. It shows that your nasal cavities is normal and you don't have any problem at all about that. I will now inspect your nasal mucosa using a pen light and will take note for its color, moisture, and smoothness. I will now use this pen light, sir. Can you please hold back your head, sir? Okay, sir. I am now done inspecting your nasal mucosa using this pen light, and your mucosa is so far is clean, clear, and no lesions, sir. I will now document my findings in the client's record. Sir Alex, the findings are all good and normal. You have nothing to worry about. Thank you for participating in this assessment procedure, sir. If you have any questions and inquiries, feel free to ask me. Thank you, sir.
Thank you. Thank you for assessing.
Good day, my name is Joanna Yvonne Tadeo from BSN 102. So I'm here to demonstrate the assessment of mouth and oropharynx. Good day, ma'am. My name is Joanna Yvonne Tadeo and I am here to assess your mouth and oropharynx. So this is important for us to know if there are any abnormalities on your mouth or oropharynx. So and not only that, but also this assessment will also give us a baseline or initial information about your condition of your cavity. So I need your cooperation and just want you to follow my instruction po. So first, I'm going to sanitize my hands po. So, may itatanong lang po ako sa inyo. So, how many times do you brush your teeth po? It is after your every meal po? Every meal po. Okay. Do you use any floss po or mouthwash? I use floss po. When was your last visit to your dentist po? Last month. So, do you take any medication that is medicated to you? No. So, this assessment po, I'm going to use my pen light and tongue depressor to palpate your mouth, and also I will wear my gloves po. This procedure po, I'm going to assess your outer lip for contour, color, and texture po. So, for the color po, there are different color po ng ating lips, which is pink, pinkish, yellow, or black. So, for the black po, nagsisymbolize po ito ng ating bad habit, kung madalas po ba tayo nag-smoke or gumagamit ng cigarette. So, for the pinkish po, alam naman po natin, ibig sabihin po, anemia po kayo. So, for the texture po, dapat po ang ating outer lip is, the normal po ng ating outer lips is dapat moisture and smooth po. So, I'm going to palpate your inner lip and buccal mucosa for color, texture, moisture, and presence of lesion po. So first po, I'm going to assess your outer lip. So ma'am, can you please press your lip like nagwiwisad po kayo? Okay po. So, I'm going to use tongue depressor po. And also, the pen light. So, ma'am, pwede po open your mouth. So, next po, I'm going to assess your teeth and gums. So, for the teeth po, titignan po natin yung number of presence of your teeth. Then, for the gums po, titignan po natin kung may bleeding, presence of edema, and refraction po. So, okay po. So, other patient po, titignan po natin yung dentures nila. So, pinapa-remove po natin ito para makita if there are bleeding, sugat, or any problems po regarding sa kanilang gums. So, next po, I'm going to assess your tongue and the floor of your mouth. So, I'm going to inspect the position, color, and the texture po. So, for the tongue po, for the position po ng inyong tongue, dapat po nasa center po ito. So, ma'am, can you please So, next po, I'm going to inspect the movement of your tongue. So, first po, can you roll up your tongue po upward? Side to side po. So, can you touch the roof of your mouth po? So, okay po. So, next, I'm going to inspect your salivary gland. So, this is important to us is if there are swelling or redness in your mouth. So, okay po. So now, I'm going to inspect your palate and uvula. So, first, I'm going to inspect the position po of your heart and soft palate for color, shape, texture, or if there are presence of bony prominence. So next po, I'm going to inspect your uvula for position and mobility while inspecting your palate po. So, can you say up po para po mag-rise ang inyong some palates? So, next po, and last, I'm going to inspect your oropharynx and tonsil po. So, for the oropharynx po, I'm going to inspect the color and texture po. Then, I'm going to inspect one side at a time to avoid the integral reflex po. So, I'm going to use tongue depressor po to press your tongue, and I want you to lift your hand and open your mouth. So next, I'm going to inspect the tonsils for color, discharge, and size. And also, I'm going to elicit the gag reflex by pressing the posterior tongue with the tongue depressor po. So that's all po, ma'am. So I'm going to document the findings po. So ma'am, there is no problems po regarding sa inyong mouth and oropharynx. So thank you for your cooperation po.
Good day po, ma'am. I am Cristel Emrina, student nurse from Colegio ng Lungsod ng Dasmariñas. May I ask what's your name po?
I'm Althea Daphne P. Martinez.
Your birthday po?
November 26, 2010.
How would you like to be addressed po, ma'am?
Maybe you can call me Thea.
So, I'll call you Althea po. What language do you prefer to use po, ma'am?
English.
Okay po, ma'am. So today po, I'll ask you some questions and do an assessment that includes taking your vital sign, checking your skin, hair, and scalp, nails, skull and face, eye structure, and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, neck, thorax and lungs, and throughout the process po, I may be touching some areas of your body, so may I ask po if it is okay with you, ma'am?
So this assessment checks if there's any problem with your health condition. So I'll assure you, ma'am, that the data I'll gathered from you po will be confidential between me and your assigned physician. So before I'll proceed po, ma'am, are you comfortable with your position now? Or are you feeling any pain right now? And if you have any concern or question, feel free to ask po. So let's start, ma'am. Can you tell your full name po? Althea Daphne P. Martinez.
How old are you?
13 years old.
Do you know where we are right now?
Hospital.
Do you know the date today?
April 21, 2024.
Can you please close your eyes, ma'am? And open it. Repeat it twice. So, can you smile for me? And pop your cheek. And next, ma'am, I'm going to say a word and I want you to repeat it, ma'am. I am Althea Daphne Martinez.
I am Althea Daphne Martinez.
Can you tell me what color is this, ma'am?
Orange.
Can you, how many times a day do you take a bath?
2.
How many times of meals do you have per day?
4.
Any food allergies po, ma'am? Are you active or not sexually?
Not.
The patient is alert and conscious. Althea, the patient is alert and conscious. Miss Althea, facial expression is relaxed and has a symmetric pace. The patient's speech is clear in normal pitch and normal pace. Patient has good hygiene and grooming. Patient is taking a good nutrition. Patient has a good posture. The patient's BP, respiratory rate, pulse rate, and temperature are all within normal limits. The patient's BMI is in normal status.
For now, ma'am, I'll be going to take your vital signs, including your blood pressure, temperature, pulse rate, and respiratory rate. Is it okay with you, ma'am? And next is I'll be going to take your height and weight. For now, ma'am, I will take your blood pressure. So your blood pressure po, ma'am, is 90 over 60, which is normal naman po, ma'am.
Next po, I'll measure your temperature po, ma'am. So your temperature po, ma'am, is 36.6, which is normal po. Ma'am, I'll take your respiratory rate and your pulse rate. So your pulse rate po is 80 beats per minute, which is normal po, and your respiratory rate is 17 breaths per minute, which is normal din po. After that po, I'll check your weight and height. So now, ma'am, I will assess your neck po. Can you please turn your head to the right? Turn your head to the left po. Turn your head like this po, ma'am. After the ma'am, look up po, ma'am. Can you please swallow po? Kaya po, ma'am. Swallow po, ma'am.